shall make it stay, make it strong. From barriers to breakthrough, we stand with pride. Sedulous collective, we're by your side, always.
To begin, though, we will have Dr. Rebekah Delsol, and Trust for London are lucky enough to have Dr. Rebekah as their grants director. She knows why I'm saying that. And she's going to start the evening off. She was meant to be the second speaker, but she's going to roll the evening off. Talking to us, sharing some of her thoughts about trust, care and power in funding community-led work. Seatbelts on. Are we ready? Dr. Rebekah.
Thank you. I wasn't expecting to go first, so please bear with me. I'm really excited to be here today because of, I think, some of the most impactful and meaningful things I've done in my work and in my life have been centred around research. The things that I've really enjoyed doing, where it's been either participatory action research or funding research or as an academic doing research. It's been the area where I felt that I've most understood need and solutions by the people that have experienced whatever we were researching. And I've managed to wear a lot of different hats, so I work...
Just people at the back are signalling.
Sorry. So speaking today about that from different perspectives I think is really important. So at the moment I'm wearing a Trust for London hat. It's an anti-poverty funder who works funding injustice across London. But my background is as a criminologist, so I worked for many years looking at racial justice across Europe and previously worked for Healing Justice looking at health equity. So I've done research from both a funding perspective where I've had the privilege of funding research, but also from a community perspective and as a researcher. And I think while it has the potential to make a massive amount of difference because it's really grounded, it should be, and often is really grounded in what need is and people's experiences and people that can come up with the solutions. What I found often happens is that there's a blocker between kind of the funding of the research and then research taking place and the outcome of the research. And I thought perhaps wearing some different hats today, I could offer some perspectives about where I think some of those kind of blockers that are also potentially areas for opportunity could come in. But I just have to add the caveat that I don't want to be an apologist for philanthropy or any of the challenges that come with funding. And I think often you get pulled into a position where you have to defend your institutional position, and I'm just going to speak from my perspective of what I've experienced and what I can see. And I'm most excited really about having the discussion today and hearing people's perspectives and experiences and what they can share and giving some ideas about where you can get some of those blockers. So some of the questions that I was asked to think about today was really like, who defines the impact of research? Who thinks about that, and then how does that impact funding? Where does the power sit in those relationships? And then what does kind of control and accountability and trust look like when we're talking about funding community-centred or participatory action research? What I think often happens is a lack of, from a funding perspective, and I don't want to give a justification for why sometimes funding decisions are made, but I thought it might be helpful to talk about some of the constraints that we're facing as funders at the moment. And these are constraints that are really, I mean, clear to everyone in terms of context and what's happening around the context in the UK, but also globally. And what that often means is that we're talking about institutions that have a concern about trust and risk and what that means practically. And so for people that are working in philanthropy, they're often having to balance that conversation between how do you prove that you're funding things or how you're involved in research that's having an active impact, how are you minimising risk because we're all trying to navigate a system or a more increasingly legal complex environment in a way that makes it safer for everyone but safer to continue doing the work that you think is impactful. And that's been really important when we're thinking about the kind of funding decisions that are made. is really how do you navigate that complexity. So people are dealing with that, and then it inevitably means that it becomes narrower in terms of what we're thinking about, what fits into priority areas. And the priority areas, I think, often is where the power sits. It isn't often as simple as though you fund this or you fund that. It's like, how is the strategy set from the beginning? How is the strategy defined in such a way, and who's been involved in that strategy decision to set that? And then when you're implementing that, it's straightforward, you fit it into the narrow strategy or you didn't. And so recognising the kind of what that means for funders on the ground in terms of setting and developing the strategy, chances to impact and be involved in the development of strategies and at that level can be really impactful. But I think that's also an opportunity for people to really try and be involved in some of the conversations at that strategic level in terms of what needs funding, what priorities are, where most need is, where research and community-led work can really have its impact, and recognising that. But also, it's also a chance to figure out who are the funders for you and who aren't the funders for you. Like seeing where there is some overlap in terms of funding, where you have some shared interests and it's worth engaging, or where actually that isn't something that would work for you. I think the other key area that feels often like a blocker is just the amount of need in competing applications. And I know that often people feel that they're in competition or they're competing with other organisations or other pieces of research. But the reality is that as budgets are shrinking, that we are forced into a position of having to make more tighter and tighter decisions, which means it's trying to think of a tactful way of saying this. Sometimes people fall back on decisions around research which ones are the ones that can have the most visible impact in the areas that we're in the policy areas that we're used to working in. So we're thinking, for us, it often feels very important for research to speak for a policy audience, because that's how we're defining impact. Impact can be defined quite narrowly, and so then it becomes what speaks to a policy audience, what speaks to a research audience. And so it becomes you fall back on the same sorts of academic institutions that you're used to working with, or turning around research quite quickly because it can be done and can speak to those audiences. So also recognising the kind of constraints around kind of policy and impact and how people are measuring that. And because the challenges around finances, one of the challenges that I've always felt is that really good community-based work has to be funded properly. It has to be funded to a degree where you recognise resourcing everyone adequately and fairly, where you recognise all the things that come around research, and the different care components that come with research, and those are the areas that often are overlooked in funding applications, or the things that are very hard to push through for funding because we're not used to talking or recognising all those additional costs, which are just key to doing it well. So there's something about changing the narratives around what research looks like, and it isn't just about paying researchers. It's not just about the nuts and bolts of the methodology and how you get to A to B. It's all the stuff around it, all the auxiliary things that are so key to make their researching meaningful, but also to make people's experiences of participating in the research and delivering the research important. And so recognising all of those things and the true cost of that. And so there's a narrative piece to shift that, where we talk about what actually it does cost, and then being able to recognise that it's a bigger cost than we would perhaps anticipate, and making a case for those resources to go to that. I also just wanted to talk a bit about different voices in research as well. I think one of the challenges that we're increasingly seeing is around how you get a range of voices in a way. So how you get a range of voices, but also how you hold competing voices and competing priorities in a way that allows them all to have voice and be pluralistic in how you're talking about it. We've often fallen into, like, we'll just have one community voice, or we'll express one opinion, and it's like, and it's hard to balance that, where we're actually talking about it's fine to have different communities talking in different ways about their different needs, and we're not going to speak from the screen sheet. But we can often fall back on the lazy thing. As long as we've got one or two voices, it's enough. But for us, I often find it's quite hard to hold those competing opinions in the same way and give them all the same value, and to make sure that we're okay with voices saying different things and being in a different place. I wanted to talk about a piece of research that I was involved in recently because I thought it might give a bit of a model of something that felt very meaningful and useful to do. It was a piece of research where I was on the other side, I was on the community side, with an organisation about young women's experiences of policing. And I think it typifies what can be achieved in terms of working with funders to do the research that matters in the way that you want to do it. I think what we found was actually the funder that we used was very flexible in terms of requirements. They were happy for the researchers and the young women involved to design the methodology and to design the output. Where the blockers really came in was the money not being enough to really cover all the needs, and the sorts of timeframes and the reporting and recording that people expected. So for funders, actually, it's needing to be able to show that you're accountable for the money that you spent, and so they had some requirements which were reasonable in themselves but were very hard to deliver from the other side when you know that all the nuts and bolts, things move all the time and you're responding to the need and the people involved. And so it worked from the perspective that we were able to do the research, we were able to fund it to an adequate level, and we were able to have total control over the research and the outcomes of the research. And I think the funder was happy with it. I think the blocker for us was then the recognition afterwards that they have a piece of research for them, it finishes, but we've handed it over, they can advertise it somewhere, but you're left still with picking up the pieces of the work that you've done and where you go with it. And so I found it was successful research because we managed to get something done that had a voice for the people involved that we wouldn't have expected to get funded. And I think that is the model to go for. If you can find something where your interests overlap with someone else and the values are enough for you to get the work done, I think there's some pragmatic steps that you can take to make it happen. The bit that I'd like to encourage us to think about is then what happens next when the research finishes. Because when it's this community-led research, it doesn't finish the day you finish a report because those experiences haven't gone anywhere. But then what do you fund after the report, after you've handed it in? And how can you think more concretely in the long term around where you take the research next and where you make it beyond a piece of research? So that's just some jumbled thoughts about the different areas that feel important to me in terms of research and some of the kind of blockers and perhaps opportunities that we can think about together.